Physical Activity is the first comprehensive healthcare system in New England to officially incorporate a new unique program into its electronic medical record system. And joining us today to tell us what this is all about is Dr. Dale Bond, Director of Research Integration at Hartford Hospital. Dr. Bond, thanks for joining us.
Thanks for having me.
Great to have you. So we understand the program is called Exercise is Medicine. How did it come about?
So Exercise is Medicine is a global health initiative, and it was launched in 2007 jointly by the American College of Sports Medicine and the American Medical Association. And they wanted to endorse physical activity to be a vital sign, just like blood pressure or heart rate in all clinical settings. And they want to assess and compare patients' physical activity level to national guidelines for physical activity. And that way they can alert providers of inadequate physical activity to prompt counseling or a referral.
All right. So how are you tracking the physical activity of patients?
So we're using this brief measure called the Physical Activity Vital Sign, or PAVS, and it's a validated measure, and it only consists of 2 questions. And we can administer these questions in less than a minute. And so the first question asks patients how many days on average per week are they engaging in moderate to vigorous intensity exercise, like a brisk walk. And then the second question asks how many minutes per day do they perform exercise at this level. And then we multiply these 2 values to calculate total weekly minutes of moderate to vigorous intensity exercise.
All right, and let's talk about what are the National Physical Activity Health Guidelines?
So our own U.S. Department of Health and Human Services, as well as the World Health Organization, they recommend that all adults should move more and sit less throughout the day. And for substantial health benefits, we should all be doing at least 150 to 300 minutes a week of moderate intensity aerobic physical activity, or 75 to 150 minutes a week of vigorous intensity aerobic physical activity, or an equivalent combination of both. And adults should also do muscle strengthening activities of moderate or greater intensity that involve all major muscle groups at least 2 or more days per week.
All right, and why is this activity important for a patient's overall health?
So inadequate physical activity is a cause of premature mortality, increases risk for several chronic diseases. We also found out during the COVID-19 pandemic that it relates to worse outcomes from that particular disease. And it exerts a heavy economic toll on all healthcare systems, approximately $120 billion per year. And so incorporating this vital sign tool into our EMR, it's going to quickly alert providers of inadequate physical activity to prompt appropriate counseling or referral. And this will also generate opportunities for multidisciplinary research to understand the role of physical activity in disease etiology, prognosis, and management.
All right, Dale Bond with Hartford Healthcare, thank you for bringing us up to date on this program.